This short video is to help you know what to expect if you're coming for a DXA scan or bone density scan. DXA or DXA stands for Dual Energy X-ray Absorbitometry, and this is a technique which uses very low energy radiation to measure the density of your bones and to see whether you have a condition called osteoporosis or weaker bones. First of all, it might be helpful to think about preparing for your appointment. Please don't take a calcium supplement on the morning of your scan. This is because it can sometimes show up on the scan. It's really helpful to bring an up-to-date prescription with you. And thirdly, please think about what you're going to be wearing. It's important to wear comfortable clothing and to make sure you've got no metal zippers or buttons in the chest, abdominal or pelvic area. If you do have metal in your clothing in these areas, you might be asked to change into a gown. When you arrive for your scan, please book in at reception, and you'll then be asked to go and wait in the waiting room. The bone density technician will collect you from the waiting room. First, they'll complete a questionnaire with you to obtain useful information about things that might affect your bone health. They'll ask you things about your medication and about your medical history. If you're a woman, you might also be asked about when your periods started and stopped. When you have the scan, you'll be asked to lie flat on your back on the padded scanner bed with your head on a pillow for about 10 minutes while the X-ray scans are taken of your hip and lower spine. In some patients, additional scans and blood tests may be required. After you've had your scan, a detailed report, usually with recommendations for treatment, will be sent to whoever requested the test. This can take between 3 and 6 weeks, and sometimes it's longer if we're waiting for specialist blood test results.